thyroid hormone is the main regulator of metabolism. So your ability to make energy, to burn fat and carbs and metabolize amino acids, that's all controlled by thyroid. So any of your symptoms that you have that are related to a sluggish metabolism could be traced back to the thyroid.
Hi there, and welcome back to the Rethink Aging podcast. I am delighted to welcome my friend and colleague, Dr. Nikolas Hedberg, today. Welcome, Nick. I'm so glad you're here.
Hi, Cindy. Great to see you again.
Yeah, great to have you here. Well, I'm going to read your formal bio, Nick. It's pretty impressive. And then we'll jump into the topic today. I'm excited to talk to you about thyroid health, which I know is a big concern for many, many women and men, but a large portion of my patient population has thyroid conditions, and you wrote the book on it. So I'll let me introduce you. Dr. Nikolas Hedberg is a chiropractic physician, board-certified chiropractic internist, and you are board-certified in nutrition through the American Clinical Board of Nutrition. You're the founder of the Hedberg Institute, which is an online functional medicine education platform that offers advanced training and certification on the role of infections in chronic illness. You have lectured nationally and are an expert in topics such as Lyme disease, stealth infections, autoimmune disease, chronic fatigue syndrome, and long COVID. So many people suffering with that. And you're the founder of the Immune Restoration Clinic here in Asheville, North Carolina, where you help people with complex chronic illness. So welcome, Nick. I'd love to just know your story a little bit. You wrote the book, The Complete Thyroid Health and Diet Guide. That's actually how I first learned about you. I had some patients ask me about you and if I knew you since you were local here, and somehow got my hands on your book and read that. And then I had the good fortune to meet you through the North Carolina Integrative Medical Society. And I'm delighted to know you, and I'd love to hear your story of how you got into thyroid health and became an expert in that area.
Yeah, it's interesting. When I first started practicing 20 years ago, I was doing health lectures around Asheville. And whenever I gave a thyroid lecture, it was just standing room only. It was just packed. All the other lectures were just kind of moderate attendance. So I knew it was a big thing. And then a lot of patients coming in, they were taking Synthroid and it wasn't doing anything. And so I just realized it was something that I really had to learn and get good at treating, because so many people have it. And, Synthroid is one of the top prescription drugs in the U.S. And Hashimoto's disease is the most common autoimmune disease in the world.
Yeah.
So it's just kind of everywhere. So you have to know it. So I did. And that's where it started.
I love that. And, similarly, in my own journey, from conventional family medicine, just off the beaten path, to functional and integrative medicine, I've learned from my patients over the years. And so many women have sought me out because they have Hashimoto's or hypothyroidism and, are not feeling better on the standard treatment, which is Synthroid, the synthetic T4. And of course, that does help many people, but not everyone. There's a good subset of people that don't feel fully well on that treatment. And so that's also been part of my journey, as well as learning about thyroid and how to help people that fall through the cracks of conventional medicine, where they're not, they're still having fatigue and weight gain and constipation and depression from undertreated hypothyroidism. So I love that that's been part of your journey as well. give us a Thyroid 101 for our middle-age listeners who think, maybe they suspect they might have something going on with their thyroid, or they have a known diagnosis of Hashimoto's or Graves' disease. Give us Thyroid 101 for our midlife listeners.
Yeah, so thyroid hormone is the main regulator of metabolism. So your ability to make energy, to burn fat and carbs and metabolize amino acids, that's all controlled by thyroid. So any of your symptoms that you have that are related to a sluggish metabolism could be traced back to the thyroid. So fatigue is always going to be the number one symptom. And then constipation also, because thyroid hormone drives peristalsis of food through the intestine. And then depression is another one because it's difficult to process neurotransmitters like serotonin if you're low in thyroid. Dry skin, dry brittle nails, and that goes back to, metabolizing fats and digesting and absorbing food. Um, so that's kind of the main function of the thyroid. And then most people with hypothyroid, about 90%, they have Hashimoto's disease. So that's an autoimmune condition. And the way to approach, thyroid issues in Hashimoto's is to work on the autoimmunity, not necessarily focus on the thyroid and trying to balance, the numbers and hormones and things like that. So if you don't have Hashimoto's, it's usually a lot more straightforward. That's usually issues with the gut and basic nutrition and micronutrients that the thyroid needs. But if you have autoimmunity, then that's a much broader, sometimes more complicated, thing that we have to look at.
Yeah, so under-recognized symptoms of hypothyroidism. Let's run through the checklist for our listeners. You mentioned fatigue and constipation, depression,
Mhm.
um, cold intolerance.
Yeah. Yeah, that's another big one because metabolism is low, so patients tend to have cold hands and feet, or just the core body temperature, the whole body is going to be cold. Like a sluggish, low appetite, that's another one. Difficulty recovering, from exercise, that can be a big one. Impaired immune function. A lot of symptoms related to sluggish metabolism are fairly common.
Weight gain is what often draws women into my office when their thyroid is sluggish, um, and also, the brain connection is huge, in terms of cognitive decline prevention. That's something that I'm always dialed into, is making sure people's thyroid function is optimized, because if you don't have enough thyroid hormone, you can, have trouble with attention and focus and mental processing, and it can, look like a picture of cognitive decline. So lots of symptoms can show up all throughout the body related to that, the thyroid's role in metabolism. Um, Give us just a overview of your lab testing for thyroid disease. And I know you mentioned that the majority of people with hypothyroidism have Hashimoto's. And I'll just interject here before I let you answer that it is interesting to me that in my formal education in medical school and residency, it was strictly focused on identifying if it's hypothyroidism, typically with just the TSH, the thyroid stimulating hormone, and then using the synthetic T4, the Synthroid, to replace the thyroid hormone, and virtually no discussion of the autoimmune piece of it, or what to do about autoimmunity. And I think that's evolving in our understanding as a medical culture of that the autoimmune piece, that puzzle is the key to address. And so I'd love for you just to talk about your thyroid lab testing and maybe how you address the autoimmunity piece, besides just simply replacing the thyroid hormone.
Yeah, so TSH is not a thyroid hormone, and that's why it's so interesting that the diagnosis is based on a hormone that is not produced by the thyroid. So that's the first thing to understand. And there are a lot of factors that can affect the TSH. So, early on, I would do TSH, total T4, free T4, total T3, free T3, and a reverse T3. And then as you get more, experienced, you don't really need all of those numbers. Um, as you know, whenever you run a test, you have to ask the question, will the results change the way I treat the patient? And a lot of those numbers, they really don't for the average person with, hypothyroidism or Hashimoto's. And then I also will test the antibodies, thyroid peroxidase and the antithyroglobulin antibodies. And so that's gonna give you the broadest picture of all the numbers, but for me, the majority of people, if you have a TSH, a total T4, and a free T4, that's a pretty good basic minimum. If they're just a more, complex, more difficult case, then I would do a free T3. Reverse T3 is really just going to tell me that they're inflamed or they're really stressed. It's just gonna tell me things that I already know just by the patient history. And then, of course, the 2 antibodies. And then a couple of other, markers that you'll see off just on general labs are going to be cholesterol. So just high cholesterol can be an indirect sign of hypothyroidism. So that's something to definitely look out for. But that's kind of the general workup that I would do.
Very good. And talk to me about your approach to the autoimmune component of the Hashimoto's.
Yeah, right. So the question is, why is Hashimoto's the most common autoimmune disease in the world? And according to the researchers, they say it's because the thyroid is just very sensitive to environmental toxins and infections, much more so than other more robust organs, like the liver. And so you have all these environmental triggers. They could be just environmental chemicals. They could
Yeah.
be toxic metals like mercury, cadmium, arsenic. And then you have the thyroid disrupting chemicals like all the flame retardants and the plastics and things like that. And then a lot of other triggers are related to infections. So, like the intestinal parasite Blastocystis hominis, that's been connected to Hashimoto's. And then Helicobacter pylori, H. pylori in the stomach, that's been connected. And then a lot of viruses like Epstein-Barr virus and herpes 6, when these viruses reactivate, they can trigger autoimmunity. But a lot of the patients, the main focus is going to be on healing the gut. And so the
Mhm.
research is clear that intestinal dysbiosis is a big driver of Hashimoto's and leaky gut. So they've found when they've looked at the intestinal barriers of kids with Hashimoto's, they found significant leaky gut in those kids. And then they also find in kids and adults, there's a lot of dysbiosis. So the bacteria are just way out of balance in these patients. So the way to start with someone who has Hashimoto's is to clean up the diet, get all the inflammatory foods out like gluten, dairy, sugar, and things like that. So the progression is usually something like a paleo diet slash Whole30. And if that works, then we stick with that. If it's not really working, then we'll go to the full autoimmune paleo, which is just a little bit more restrictive. And so those are the dietary approaches. And then supplements are just going to be, different depending on the patient, but I do use a lot of probiotics in these patients, usually triple probiotic therapy, a lacto-bifido blend, Saccharomyces, and a spore-based probiotic. Those three um, usually work really well in these patients. And there was actually a recent meta-analysis that found patients who take probiotics with hypothyroidism, their thyroid numbers improve, the TSH, the T4, and the T3. So that's kind of a general, beginning approach to the Hashimoto's.
Mhm. Excellent. And I'm aware of some research showing that a adding selenomethionine, can help with the autoimmune component of Hashimoto's as well. Talk to us
Mhm.
about what
Yeah.
you know on the micronutrients, that are important and that are often deficient in hypothyroidism.
Yeah, so the main micronutrients to think about with thyroid are iron, zinc, selenium, iodine, and tyrosine. Those are really the top five. Magnesium and CoQ10 are also important. They're going to be a little bit more secondary, but those big five I mentioned are the first ones you want to look at. Tyrosine, I don't supplement with that. Thyroid patients tend to do well on a higher protein diet.
Mhm.
And so you're going to correct any tyrosine deficiencies just by optimizing their protein intake. And then you mentioned selenium. So about 200 micrograms a day
Yeah.
of selenomethionine is all that, most people are going to need. And then zinc is about 20 to 40 milligrams a day. But you do want to balance that with copper if they're going to be taking it for a long time. So you want a zinc to copper ratio of 10 to 1. So, for example, if they're taking 20 milligrams of zinc, they need about 2 milligrams of copper. Um, Iron, you are going to see iron, their ferritin levels are going to be low in a lot of hypothyroid patients. So they don't have a lot of iron stores. These are a lot of women who have had very heavy periods for a long time, or they just have a lot of digestive and absorption issues in the gut, and they're not able to digest and absorb the iron, or it could be a combination of the two. And then iodine, um, I'm not into the mega dosing, 25, 50 milligrams a day. That became very popular almost 20 years ago, and I found that those high doses, there's a lot of adverse reactions in certain patients. And then I also saw patients coming in who tried that on their own, and they'd actually developed thyroiditis just from such a high dose. So iodine, the way I approach that is I just make sure that they're consuming a regular amount of iodine. I think that the thyroid doesn't need any extra iodine in massive doses. It just needs what it needs, and you can get that from food sources. So those are like the top micronutrients for thyroid.
Okay, excellent, and I love that you brought up the underlying root causes of Hashimoto's, the autoimmunity, and included infectious issues, um, that that really isn't, emphasized in conventional medical training. Um, how do you approach that in terms of testing, diagnosis, treatment with your, patients with hypothyroidism?
Yeah, so there was a paper published on blastocystis hominis, the intestinal parasite, and Hashimoto's disease, and they found that if they treated the blastocystis hominis, the patient's thyroid antibodies improved, and their thyroid hormone numbers also improved. So that's one example. So, I would use herbal antimicrobials if they have blastocystis hominis on a stool test. And then you can just test through any of the major labs, LabCorp Quest for Epstein-Barr virus and human herpes virus 6. and, see if those are reactivated. H. pylori you'll also pick up with a good stool test. And that's important to know because they found that there's a few papers on this. If a patient with hypothyroid also has active H. pylori and you treat the H. pylori, the amount of thyroid medication they need decreases. So the H. pylori is causing inflammation, gastritis, possibly hypochlorhydria. And so by treating that, you're just going to improve the digestion and absorption of the thyroid hormone that they're taking. So that's another one to look at. I've also seen a paper on Lyme disease as a trigger of thyroiditis. So, you want to evaluate for that. So it's just a matter of running the tests and then addressing each infection that you find.
Excellent. And let's delve a little bit deeper into that gut-brain thyroid connection. What are your strategies for helping people from a lifestyle standpoint and from a nutritional supplement, herbal, botanical
Mhm.
regimen with the typical
Right.
things that you see in someone with Hashimoto's?
Yeah, so for the gut, we're going to start with, I had mentioned earlier, like a paleo diet or an autoimmune paleo. Some of these patients will also have SIBO, because if you have hypothyroidism, you're at a greater risk for SIBO. And so in that case, we would use a low FODMAP diet. But those are kind of the big three diets that we'll use. And then putting the patient on a higher protein diet. Hypothyroid patients always do better on a higher protein diet. So that's kind of the beginning of healing their gut. And then the triple probiotic therapy, herbal antibiotics if they need that. And then I'll also use immunoglobulins like IgG, can be very helpful in healing the gut. I'll also find a lot of these patients are deficient in L-glutamine. So I'll use L-glutamine, about 5 grams twice a day on an empty stomach is a good start, and that really helps to heal the gut barrier. There's also some powdered, gut formulas out there that have a lot of compounds and herbs in them that will heal the gut barrier. So I'll use those. And then fasting is also very helpful for autoimmunity and healing the gut. So I'll do a 24-hour fast 1 day a week. It's usually a dinner to dinner fast. And the patient just picks, 1 day out of the week. And that tends to really help them feel better and improve their gut healing.
So helpful. Thank you for giving us that overview. Um, I just wanted to point out and highlight a couple things that we didn't touch on in the beginning in terms of our checklist of symptoms or signs that might clue someone in that they might have a thyroid issue going on. You mentioned heavy periods, and that is one. It affects our menstrual cycle. So heavy periods can be a sign of under or undiagnosed or undertreated hypothyroidism. You mentioned elevated cholesterol, and that is so clear cut when I have a patient who I'm treating for hypothyroidism, and the laboratories show the TSH bumps up, that they're not on sufficient dosages, then there's a clear connection with an increased cholesterol values as well. And so we don't necessarily focus on trying to get the cholesterol down through drugs or other measures, but just at first treating the hypothyroidism most optimally. And then I wanted to also touch on the mental health and the brain cognitive impact of hypothyroidism and Hashimoto's. So I think that's so important. And, it's anxiety, depression, trouble focusing, and that can make it hard to do all of these lifestyle medicine interventions, shifting diet. How do you help your patients? What advice do you give them in terms of the self-care and nurturing that needs to be a part of this process of healing with the thyroid?
Yeah, that's really important. Um, Stress negatively impacts thyroid. So cortisol and adrenaline both impair thyroid hormone. So we have to
Mhm.
talk about self-care, stress reduction techniques like meditation and tai chi and yoga and taking time for yourself, getting outdoors, getting natural light as close to sunrise and sunset as possible, and not pushing yourself in the gym. This is something I see a lot
Mhm.
of. Excessive exercise very quickly slows down the thyroid. So that's one of the classic signs of overtraining. When you're pushing the body too hard, the thyroid slows down to conserve energy and resources. So sometimes I just have to have patients exercise actually a little less or not as intensely. That can be something that's important. And then sleep, as soon as you disrupt sleep, as soon as you don't get enough sleep, your thyroid starts to shift in a negative direction. So, sleep is a big one. Um, the other things that I will use if stress is an issue are adrenal adaptogens. There are a few studies on adrenal adaptogens and thyroid function and symptoms, like rhodiola rosea. That's been shown to improve hypothyroid symptoms, and ashwagandha, that's been shown to improve thyroid hormone levels, T4 and T3, and
Interesting. I'd like to pause you there for a second
Mhm.
because I know that there is some information out there on the internet about ashwagandha having a negative impact for people with Hashimoto's, and it always comes up in our patient discussions, and I find that it's helpful. What do you know
Yeah,
about the concern that it may, have a negative impact for the autoimmunity?
right. Yeah, this is just a fundamental misunderstanding of immunology, and unfortunately, there is information out there on ashwagandha and the thyroid, and there's a couple issues with that. Number 1, in traditional, classical herbalism, ashwagandha is one of the most fundamental herbs for hypothyroidism.
Hmm, glad to hear
Um,
you say that.
yeah, I mean, that's a foundational herb, and it's one that I've used also for, 20 years successfully. One of the issues is a misunderstanding about TH1 and TH2 because there's information out there about how ashwagandha affects that part of the immune system and could potentially exacerbate Hashimoto's, and that just isn't how it works. When you take it, it's a modulator. It's not going to drive an autoimmune response for the thyroid. And then the other issue is that you know people talk online about ashwagandha being a nightshade, and so it shouldn't be used with the autoimmune paleo diet. But what they don't know is that there's a particular compound in nightshades that do have a negative effect on autoimmunity, and ashwagandha does not have that
Okay,
compound like the other nightshades do.
interesting.
So yeah, it's one of my favorite herbs for Hashimoto's and hypothyroid. It works great, and I've never had a patient have any problems with it.
Super. Well, on that topic, are there any other myths about thyroid disease that you'd like to clear up for us?
Yeah, well, goitrogens are another thing. Again, we're in kind of the age of everything needs to be black and white, and nothing is ever that simple in the body. So people with low thyroid, they can safely eat goitrogenic foods as long as they're not in excess. So if you just eat goitrogenic foods in moderation and they're cooked properly, then that's not going to have any kind of significant impact on thyroid function. Sure, if you ate too many of them, you know, if you or me, like, I don't have a thyroid problem, but I could create one if I ate enough raw goitrogens.
Yeah, and, I I'm glad to hear you say that. I That's what my intuition and clinical experience has been as well. I did have one patient who lived in a rural area, and she had her own garden, and she grew a lot of, goitrogenic vegetables, and she did have a negative impact on her thyroid from just having a very limited diet, but as far as people cutting out, Brussels sprouts or what are the goitrogens, again?
Yeah, I mean, the brassica vegetables, some of them can be goitrogenic, and then soy,
Mhm.
can also be goitrogenic. So it's just, specific plants, they have compounds that a goitrogen is just a food that has compounds that inhibit iodine uptake into the thyroid gland.
Mhm.
I mean,
Okay.
that's all they are.
Got it, got it.
Mhm.
Excellent. Well, Nick, we're wrapping up here, out of time today, but thank you so much for being here and sharing your wisdom and knowledge and experience around the thyroid. I know you have lots of other areas of deep expertise as well, and so love to explore that more with you in the future. In the meantime, let our listeners know about that thyroid book that you wrote and where they can connect with you, especially if they're a practitioner that wants to learn from you and the Hedberg Institute and also with your clinical practice.
Yeah, my practice is, the Immune Restoration Center, and that website is drhedberg.com, and then my Functional Medicine Institute is hedberginstitute.com.
Super, super,
Mhm.
excellent. And don't forget the complete thyroid health and diet guide. We have to
Yes.
plug your book. 'Cause that's how I came to know you. Excellent. Well, thank you so much. I know that our listeners will appreciate having this, you know, peek into your wisdom in the thyroid health arena, and
Mhm.
just appreciate your time for being here.
Yeah, well, thanks, Dr. Libert. I really appreciate you having me on. Always good to see you.
Great to see you too, Nick. Thanks for watching. If you enjoyed this episode of Rethink Aging, please like, subscribe, and share it with someone you love. For more episodes and highlights from the show, you can check out more videos right here and here. I also invite you to join the Rethink Aging community at caringforthebody.org, where you can find more resources on how to better protect your brain, strengthen your body, and live with purpose. Thanks again for tuning in, and I'll catch you in the next episode.